Mary and I, go by the moniker of the Forbidden Doctor, but we're not the Forbidden Doctor. The Forbidden Doctor isn't some reclusive hideaway on the south side of town that's hidden in some backdoor garage room or some poor fool of a med school dropout who's secretly performing, hidden surgeries.
No.
The Forbidden Doctor is that beautiful, marvelous, almost miraculous healing force that's inside of you and all of us. Hey, everybody, it's Dr. Jack.
And Mary.
And welcome back to the Forbidden Doctor podcast. This is podcast episode 161, Acute Problems, What to Do When You Do Not Know What to Do.
Yeah, we're going to run through some really fast stuff.
So we're going to be talking about is what we can do for ourselves and our families at home when we're stuck with an apparent health situation that does not require emergency attention.
Or you're not bleeding.
Yes, nor the use of antibiotics.
Yes.
Complaints such as gallbladder pain, childhood and adult fevers, stomach, intestinal issues, burns, depression, anxiety.
Burns? Did you say burns?
Burns, skin burns, topical burns, and sore throats when you don't have time to be sick or heartburn or any of that stuff. But we're talking about to a level of more than just some small notice.
Yeah.
We're talking about a level where you think you got to go to the ER, but all they're going to do is just send you home with some Tylenol.
Or an antibiotic. But
Yes.
Before we get to that, for our regular listeners, the next 4 minutes is our financial stuff. So you can fast forward right through it if you choose. But our new listeners, please listen at least one time so you understand how we do things around here.
So before we begin this informative and forbidden podcast, we want to take a few minutes to talk about why we do not have sponsors.
Yeah, we've been approached many times to sell different products on our show.
But we've always been compelled to resist these financially tempting offers because many times they lead to an attempt for editorial control over what we say.
Yeah, and what we're doing here is too important to be controlled by corporate interests. So we never allow this kind of advertising on our show.
And so that said, we don't make money from these podcasts. All of our income comes from your interaction with us and what we have to offer and from the sale of our Forbidden Doctor products and supplements from the oldest and original whole food supplement manufacturer in the United States, Standard Process.
Yeah.
But we're not paid by Standard Process. Indeed, they distance themselves from open internet promotion because of constant scrutiny from the FDA.
Yeah, and as a result, they do not advertise or pay for advertising outside of a licensed healthcare professional's office.
And the reason for this is really simple, because their products are very powerful and they actually work.
Yeah.
So they need to be careful about people making claims. Others have mentioned that while the knowledge we share can't be found anywhere else, it is often tied to Standard Process.
Yeah, and that also includes our own ageless thyroid and long life energy enzymes products.
Yes, and so you might ask, could not our own products be creating a conflict of interest? Mm-hmm. I mean, have we mistakenly created infomercials instead of free knowledge podcasts?
No, we do this on purpose.
Yes, because years of experience on the radio and in our clinics and almost 500,000 downloads of our podcasts have taught us a few things. And the most important is that the type of nutrient-dense foods that most of us need to get our bodies actually healing from years of malnutrition are not easily integrated into most of our lives.
Yeah, the quest for excellence in nutrition has never been an easy task. Just face it, nobody wants to eat raw liver. But absolutely no one will sign up to eat raw liver daily for 6 months. So we feel therapeutic supplementation is sometimes very critical in the healing process.
Yes, it is. So let us be clear. We talk about Standard Process because this is how you can get whole foods in a concentrated form that you would never, ever eat on a daily basis.
Mm-hmm. And the reason we do our podcast this way is because it has saved our lives and countless others that we've worked with over the years.
Yeah, so we sell supplements.
Yeah.
And so we try to give free knowledge away about how nutrition touches every aspect of our lives. And so necessarily these two are going to overlap. But the bottom line is, we may mention supplements that you can get from our website, but the knowledge we share is real. And you can take that with you forever, whether or not you ever buy anything from us.
But you can support us in keeping this podcast on the air with a donation at forbiddendoctor.com www.myriad.com/donate.
Yes.
Or if you're ready to take your first steps for your own health, you can join our family by going to our website and taking our free symptom survey.
Now, we understand, we really do, that some of you may feel real hardship with even a modest purchase and cannot afford even a single month's supply of supplements. So please know then, it is completely okay if you do not buy our supplements or financially support our show in any way if you cannot afford to.
Yes. However, there are many ways to support us for free. You can give us a 5-star rating on iTunes. That's easy. Or a thumbs up on YouTube. Wherever you listen to our podcast, just give us a good rating.
Yeah, and if you already support the show, thank you. Truly, thank you. And please know that you are the very reason we fight this good fight. I mean, your support makes this all possible.
So now let's get back to the forbidden information they don't want you to know.
Oh, yeah.
So you wake up one day with a terrible sore throat. You feel a little achy, a little whatever, but you don't have time to have a sore throat. I have to tell you, one of our standard process mentors that teaches all over the country, he's got his doctorate in Chinese medicine and all kinds of stuff. Anyway, he had to give an incredible seminar. He does. He gives wonderful seminars.
He does. He's one of the best.
Michael Gaeta. He said that he woke up with a sore throat, and you can kind of feel that strep throat kind of thing.
Oh, you feel it kind of starts as a little scratchy itch in the back of your throat.
Well, and then it's sometimes really sore. He said, I didn't have time to be sick. So those of you out there that don't have time to be sick, he started taking Echinacea Premium Liquid.
Yes.
This is an herb, and it is strong. And if you get the real herb, it makes your mouth tingle like crazy.
Yep.
You can really tell. Anyway, he said he went through like 2 bottles of that in one day or a day and a half or something, or a bottle and a half. I don't know. He said you can't take too much. And he said he was all better.
Before he had to give his
presentation, his seminar. So that is a wonderful thing, Echinacea Premium Liquid. Now, we do have it in pills, but the liquid works better, according to Michael Gaeta. The other thing
is what I have right here in my hand. Listen. Herbal throat spray.
Herbal throat spray. I have gotten rid of sore throats in my kids and with patients with just that.
Yes.
Just that. It's got some incredible herbs in it, and you just spray your throat, and it does a wonderful... I mean, it's more symptom relieving, but it actually is medicinal with the herbs that are in it. Now, another one that we would recommend for these sore throats, I went to Hawaii, this is a couple years ago, for my daughter's wedding, and I woke up with a sore throat, and I was like, oh, no, I can't have a sore throat. I can't be sick.
Yes.
I had some stuff with me. I don't know that I had echinacea, but I had astragalus, which is astragalus complex. It's a medi-herb that we have on our website, and I started taking 3 like every 2 hours. You can't take too much astragalus either. I took a whole bunch of that, and it was gone.
Oh, yeah.
I was there, a week?
Yeah, well, I've had astragulus do wonderful things for me.
Yeah, I didn't have any
upper
sore
respiratory infections.
And then the number one, go ahead.
Well, Conjaplex.
Yeah.
And
this is for congestion.
Oh,
that's
and
why
this
it's named Conjaplex.
Just a couple of weeks ago, Jeannie, a patient of mine, that I'd taken care of for low back pain and some sciatic type problems, I could tell that she was having some upper respiratory stuff. She says, oh, it's just terrible. I can't breathe, and this came on so fast. What do I do? And I said, well, we got this stuff here that we affectionately refer to as a miracle. It's called Conjaplex. And what it does is it provides calcium and some and RNA
Cataplex,
and
ACP,
and ACP and some other nutrients,
C.
right? That in a very concentrated high dose form seems to help to break up congestion. It'll support your lungs cleaning themselves out. I want you to take 6 of them immediately and 3 of them every 2 hours while you're awake. Don't wake up in the middle of the night to do it.
You need your sleep.
Yeah, she said, and then I didn't see her for a week. She said, man, you are right when you called that a miracle. Within a day and a half, whatever that was that hit me, that usually takes 2 weeks for me to get over, I was over it in a day and a half.
Yeah, so I have Conjaplex. The plex stands for a complex, has a whole bunch of stuff in it, and the conja stands for congestion, Conjaplex. In fact, we have a story with a son in Wyoming whose father was a chiropractor. They got strep throat. He didn't take him in to get an antibiotic, which actually
School nurse sent him home.
Mm-hmm. Antibiotics work pretty well on strep because it is bacterial, but even still, He just gave him Conjuplex. That went clear to the...
Well, the very next day, he went back to school.
Yeah, and
the school nurse says, what are you doing here? He says, well, I feel fine. Oh, you went to the ER. No, my grandfather gave me these pills.
His grandfather.
Yeah, gave me these pills. What pills? So she immediately reports him to the county health people for practicing medicine without a license, and they actually bring charges against him.
Yeah.
The county government, and I forget what county it is, but it's up there right next to Sturgis.
You take way too long to tell these stories. So.
Just across the border from Sturgis in Wyoming. And so he has to go to trial. He has to go to court.
He spent $100,000 on
of
lawyers.
his own money.
Of his own money.
And they find him guilty.
Yeah,
and so he appeals to the state Supreme Court.
Mm-hmm.
And it goes through the Supreme Court, and finally
he won.
He won.
They gave it away.
And the head justice, there's 3 members, and the head justice said, Dr. Thompson, from the bottom of my heart, the entire state of Wyoming owes you the deepest of apologies for this horrible, horrible misuse of jurisprudence and enforcement of law in the state of Wyoming.
Did they give him back his $100,000?
I don't think so.
No,
I don't think he got his money back.
I think they had a fund going for him.
For something like that.
Unbelievable.
But the Supreme Court said this should never, never, never have happened.
And the other thing for strep throat, which is extreme, this is one that you love.
Cal-Ammo.
It's Cal-Ammo. Cal, C-A-L-ammo.
It's calcium ammonium chloride.
It's very cheap.
It's the very salt that keeps the oceans acidic. If the ocean water wasn't so slightly acidic, there would be no life on this planet because there would be an vast overgrowth of bacterial agents in the ocean that would kill ocean life. And then because of that, because of the oxygen transfer and everything else, there would be no life on the planet. What Cal-Ammo does is acidify the tissues.
And it lasts
bacteria cannot grow in an acid condition.
That's right. And it lasts in the body a long time.
4 to 5, 6 hours at a time.
A nice side effect of Cal-Ammo is it clears up acne.
Oh, yeah.
Our son, our 19-year-old son, will not be without Cal-Ammo.
Yep.
He loves it. So, again, sore throats, Echinacea Premium Liquid, Herbal Throat Spray, Astragalus Complex, Conjuplex, and Cal-Ammo. That's
you have
the one
these things in your medicine cabinet. You won't need medicine. Oh, did I say that?
Ooh.
These don't treat. These
don't
just
treat.
support the body.
Support your own immune system to fight.
Right.
What it knows how to
Next
fight.
one, gallbladder pain.
Ooh, this is a bad one, man.
Remember me in, where were we? We were down in...
Arizona somewhere.
Yeah, Tempe or Scottsdale at a conference. And bam!
You got hit. Well, we danced the whole night before.
I must have danced 4 hours with you.
You jiggled those little stones right out of your gallbladder into the duct.
Blocked
and one
the
got
duct.
stuck. Now, this is acute.
This is acute.
But
anybody else who's less of a man would have gone straight to the ER and probably had their gallbladder taken out.
He cried.
I cried. I remember my knees on the floor, my head and arms up on the bed. You thought I was praying. And you said, Jack, you don't often cry when you pray. I was in some pain. And it's one of those things where you gyrate into different postural positions trying to get out of the pain. And then we came home.
And this is what birthed our gallbladder cleanse handout that we have. You can get it from our office. I should put it at the end of this podcast.
So we get home. We make it back to Salt Lake, and I'm on the floor there in the where we were living, just rolling in pain, and I'm looking through all of my books, and I come across John Heinerman, who's written a lot of books on natural healing, lives in Salt Lake. So I called him up. I said, John, you don't know me, but I'm so... Oh, no, I've heard you on the radio. I know who you are. I'm dying. And he said, well, did you use
catnip.
Catnip.
Catnip tincture.
Tincture of catnip. And I thought, no, I never heard of that. He said, you go get a fresh bottle of catnip. Any health food store is going to have a tincture of catnip.
Or just like Harmon's or Albertsons. They have it. Well, they have tinctures
They have
now.
a lot more stuff now than they did. This is like 20 years ago, practically. Yeah. And he said, you take a very hot cup of water, so hot that it'll almost burn you, but not hot enough to burn you. Put in 40 drops of the tincture of catnip. And he said, if that doesn't stop your pain in the next few minutes, I will write you up in my next book.
And it did.
It
worked. Now, that's for serious stuff. I'm talking, the reason I added this into the podcast is if you just feel that gallbladder.
Yes.
You're not crawling on the floor crying.
But there's this little sharp pain there
you
that
feel
won't
it.
stop.
You lay on your right side and you just feel this ache, especially if
you can also feel it underneath your right shoulder blade. That's a referral pain for the gallbladder.
Oh, good to know. But anyway, you simply chew up AF beta food. It thins the bile, so the bile in your gallbladder can come out easier.
Yes, it doesn't get backed
and
up.
it also makes the gallbladder contract. It's called AF beta food. Stands for vitamin A and vitamin F and beta food. Or you can just get beta food. That's even stronger, actually. Yes. But AF beta food, I prefer that in a way because then we get more of those vitamin A and vitamin F we need so badly in us. But just chew that up. And I'm talking chew up 30 of them. I mean, 12.
Well, they're just beet greens.
Yeah, they don't taste real bad.
Actually, they taste sweet.
Yeah, they're not too bad. Just chew them up. I've had another lady that completely, she never had another problem with her gallbladder after chewing these
And
up.
then there's that doctor in New York who specializes in gallbladder removal, cholecystectomy. He never took out another gallbladder after that. He put all of his patients on beta
that
food.
was a doctor that sells Standard Process.
Yeah, he's a medical doctor.
That's
a
an
surgeon.
honest doctor.
A surgeon. He says, I never had to take out another gallbladder.
That's $15,000 a pop, man. That's a nice man.
Yeah,
Do you know his name?
His kids had to start getting student loans.
Yeah.
No, that was a long time ago.
We could refer people to him. That's great. Okay, so AF beta food and catnip. Then the other one is cholecols, because usually the reason you get you get stones stuck in your duct is because you can't emulsify the fat. So cholecol will help you emulsify.
They're frozen bile salts.
It's purified bile salts, and it will help you emulsify the fat that you eat.
Yeah.
And cholecol I use if you get an upset stomach too, just like you just feel nauseous. It's for different reasons, but I always try cholecol if somebody gets nauseous in our office. Pop a few cholecol. Don't chew these.
Oh, they're terribly bitter.
Ooh, they're terribly bitter. But then also the bitterness is really good for your digestion. We have all these receptors for bitters through our intestines and even in our lungs, everywhere for bitter that we never eat. So cholecol is wonderful for emulsifying, helping you with gallbladder pain, along with AF beta food. And if you get in a real bad spot, then chew up the AF beta food and take the catnip.
Yes.
Okay.
Next one, heartburn. Oh my gosh, I feel like, I'm on fire. I'm on fire.
No, it's nothing to laugh about. Heartburn is very, very painful. When an immediate way to stop heartburn, like right away, and we definitely tell you not to run to Tums or run to an antacid or anything like that, although we do understand it's very, very painful. You run and you get Multizyme, and you open up the little capsules and you dump it on the back of your throat, and I promise you, the heartburn will go away.
Very quickly.
Yes. And you might have to put 2 in there, and you might have to wait 5 more minutes and put another one in, but that's as long as anybody's ever told me you have to do it. I have done it before when I've gotten heartburn, and I don't remember why, but just open up a Multizyme and dump it on the back of your throat. Now, that works really well. But people that have chronic heartburn and they're burning, there's nothing worse than that burning going up your esophagus. If you will chew up chlorophyll pearls, okay? If you will chew.
Yeah, this is not water-soluble chlorophyll. We're talking about the oil-based chlorophyll that's in these black pearls.
Which you can't find anywhere. They're not anywhere on the market in any health food store. As far as we know, and you can let us know if it's somewhere else, Standard Process is the only company that has fat-based, fat-soluble chlorophyll. You chew those up and it soothes the esophagus. Now, here's the other problem. When you have heartburn, usually it's because you have digestive problems to beat the band. So you might get some burping after you chew up the chlorophyll because it's fat-based and your gallbladder's not working really well. Your pancreas might not be working really well, and you can't emulsify the fat, and it kind of makes you sick, and you burp it up. So that's when, again, you pop some cholecol. Did I confuse you?
No, that's pretty good. That's the bile salts.
So here's what I do with people in the office. They're like, I have heartburn so bad. I have them chew up some chlorophyll. Ooh, it soothes the esophagus all the way down to the stomach. Then they start burping, and then I throw in a couple cholecol that helps emulsify the fat, and they're like, oh, I feel all better. How did you do that, Mary? That's what we do, okay? Then, if you want to heal this, take Gastrix instead of those Tums, instead of that Prilosec, instead of those antacids that you've been taking for years. Take some Gastrix. We don't recommend taking Gastrix forever, but for like a month, take 2 or 3 or 4 Gastrix before you eat, and it will kind of neutralize the acid in your stomach, but it's got ochrapepsin and a whole bunch of really healing. It's got chlorophyll in it too.
Yes, it does.
So it's really healing. Take that for about a month to heal that ulcer and that inflamed and the never-ending ulcer, as we like to call them, in your stomach. With chlorophyll will really help it, and Gastrix will help for about a month, and then switch to Zypan, and take Zypan to help retrain your stomach how to make hydrochloric acid.
And retrain is a real word here.
Yeah. You will never get heartburn again.
That's right.
It is so easy to fix. And if you don't fix it, you can't break down proteins and fats and carbs and everything for the rest, and that's when diseases start. So this is really critical. So for immediate heartburn, take Multizyme on the back of the throat, chlorophyll to stop the burning, Colocol if the chlorophyll makes you burp, and Gastrix for at least a month to help the healing, and Zypan for, I don't know, what do you think, 3 or 4 months after that?
Usually that's all you need to do.
Yeah, and then you're good to go.
All right, next one, topical burns.
Ooh, this is a good one. Topical burns or chlorophyll ointment. There is nothing better. In fact, in my opinion, I think it's criminal, and I mean criminal, that this is not in hospitals for burn victims.
Yes.
It's super messy. That could be part of the problem. And it's a little bit expensive. This one is expensive. And you put it on a burn, and the pain is gone immediately. There's no immediately. The guanidine that's created from this horrible burn is neutralized immediately. It's like those antacids, but this is a good thing, and it neutralizes that nerve pain. And not only is the pain gone, but it doesn't scar. I had a burn on my arm. If you could see my arm right now, and I have a scar from it from years and years ago, which is no big deal. But I burned my leg on my Harley-Davidson motorcycle pipes. Long story. But anyway, it bubbled up, and it was horrible. And by the time I got home, I was crying, and I thought I was going to have to sit in a bathtub all night with cold water, and it was terrible. But I put chlorophyll on it, and not only was the pain gone immediately, there's no scar. If I could show you, there's no scar on my leg from that. So chlorophyll is just brilliant. It should be in everybody's medical.
There's the experience of my brother, too, with the chainsaw.
Oh, yeah.
We were out camping together, and he burned his hand badly on the muffler of the chainsaw. And he wanted to go to the ER because it was a bad burn. And I said, hey, I want you to try something. We had it with us at the time in our camping equipment.
Always have it with us.
We always carry it with us. And smeared it all over his burn. Immediately, the pain stopped. We put a bandage over top of it. By the next morning, a loose bandage. By the next morning, the massive blistering had reduced down to almost nothing. The pain was gone. Yeah. And within a day or two, it had healed, and there was no scar.
And he could not believe it. Just the other day, I was carrying some tea, really hot tea, up the stairs, and I went to pick up something, and of course, it spilled all over the inside of see right here? I don't know if you saw the bandage.
You know, the bottom of your thumb.
Yeah. See, yeah, there's no scar, there's no anything. This was just like 3 days ago, and I put chlorophyll on it with a loose bandage. I had it on all day, and it never hurt, and it's gone. There's no scar, there's no anything. And maybe it wasn't terrible, but keep it with you. Chlorophyll ointment is different than chlorophyll pearls. So know that there's 2 different products there. But I would always keep, there you are, spraying that herbal throat spray. That's good. And know that there's 2, chlorophyll pearls and chlorophyll ointment, and always keep them both on hand. At least the ointment for sure.
Okay, let's go to fever.
Okay, fever.
Fever, and it depends on whether we're talking about an adult or a child.
With a child.
With an infant. Let's start with an infant because their fevers are usually different. Not only are they the result of some kind of infectious process, but if they're teething and they don't have enough calcium in the system, the body will raise the body's temperature to leach the calcium out of their bones for their teeth.
Did you hear that?
Yes.
It raises. No, I know you heard it because you said it.
And what's the quickest remedy for the temperature in a child? Powdered calcium stirred up in water and have them swallow it
because you don't want
minutes.
You're not letting me talk.
It's my show.
You don't want the calcium in your child's bones to be sucked out. So think of that. It's sucking out the calcium to make teeth for the baby. So you want to help them nutritionally with powdered calcium. Now,
calcium lactate.
Calcium lactate powdered. It has to be on an empty stomach because otherwise, well.
The calcium will bind with phosphorus or something else if there's other food in the stomach. So it needs to be on an empty stomach.
Well, yeah, it will go to the bones, which would be good in a child's case. But
100 years ago, they used barley water.
Yeah.
They knew back then a child having a fever, give them barley water. They would take barley pearls, soak it in water for about 8 to 12 hours, throw away the barley pearls, and have the child drink the water. And all of a sudden, the fever would come down. Well, now they know why. It's because the barley pearls were inundated with calcium that got into the water as calcium bicarbonate, immediately went into the system.
So for an adult, you want to get up in the morning or anytime you have an empty stomach and you want to take powdered calcium on an empty stomach. Now, to push that calcium into your tissues, you want to take Cataplex F. Or if you're a child, you can't take those pills, then you open up Super EFF, which is a capsule, and just sprinkle it in their mouth or on some food. But Cataplex F and Cataplex C, which is vitamin C, but it's the whole food vitamin C. So those three things, powdered calcium, Cataplex F, and Cataplex C. One caveat here, powdered calcium can give you diarrhea, so you do it to...
Because of the magnesium that's present.
Yes, because it's 5-1. So you do it to bowel tolerance. It's not the worst thing in the world to get some diarrhea unless you're out and about. But do it to bowel tolerance. And
now, some fevers, you just leave them alone. 101, 102, 103.
Well, but these won't hurt anything to take. I mean, this...
No, they won't hurt to take these things anyway.
Because fevers are good.
Because usually, if you have a fever as a result of an infection, your body raises temperature because the raised temperature activates the immune system. There are the bariatric physicians that when people who have chronic diseases, a lot of times if they go into these bariatric chambers where the temperature, not the air pressure, but the temperature raises their induced fevers kind of a thing. There are aspects of your immune system that comes to life as the temperature hits 101 or higher.
Yeah, so fevers are really important, but this will bring the fever down if it needs to.
Yes.
But calcium is the most antiviral substance that we know of. So you want to take calcium when you have a fever.
Yeah.
Just remember that.
We have podcasts on that.
Many, but calcium, Cataplex F, Cataplex C, that's vitamin F, the fatty acids, the essential fatty acids that push the calcium into the tissues, and Cataplex C, which is vitamin C, that is kind of like the bullet in a gun.
Yeah.
You know, to kill whatever.
All right, how about headaches?
There's only one cure.
We're not allowed to cure anything, but that's what I do, the structural work I do in the clinic. There was a young lady that came to me Monday of this week, and this happens to be Saturday. She came Monday, and she is she's a cheerleader, but she's the flyer, not the catcher.
Ooh.
And as a flyer, she's had 3 concussions.
Oh.
Kicked in the head, dropped, all this stuff. So she started developing terrible migraines.
Migraines, yeah.
Well, I've taken care of other members of the family, so can't hurt. Let's take her in.
You don't hurt people.
Within a very short period of time, the headaches were greatly reduced. I received a text from her thanking me in the clinic because her headaches are greatly reduced already with just one treatment.
Well, we have thousands of testimonials.
But that's just one of thousands.
About migraines. And so there's actually one other thing we do for headaches, and it works really well. Now, these are not migraines, but just a headache. If you will chew up the chlorophyll pearls.
Yeah, in some cases that really will help.
Yeah, you only need a couple because it helps inflammation in a good way. It's not an anti-inflammatory like steroids and stuff because inflammation is the body's way of bringing nutrients to a part of the body to heal. So you don't want to stop that. You want to support it. And so chlorophyll pearls will help reduce inflammation in a supportive way. And inflammation of the cerebral spinal fluid is helped with chlorophyll pearls. And so we recommend just chewing a couple of those, maybe 3. In fact, we had a doctor, this was 18 years ago when we went back to a standard process seminar. It was their 75th anniversary. And
yes.
They've now been in business 90 years. So it was a while ago. And he was a pain doctor, and he said he got rid of almost all his patients' pain when he found out about chlorophyll pearls. He still uses some narcotics and some other techniques, but he says almost all of the pain, he has them chew chlorophyll pearls. So that's another wonderful thing for headaches. But if you have migraines, definitely find a board-certified NUCA doctor in your area.
Okay, we got 2 more. Heart pain or palpitations.
Okay, first thing, go to the
emergency room.
Go to the emergency room first.
Don't fool around.
Yeah, we don't mess with that one.
And if they send you home saying, well, they do an EKG, and they won't necessarily do a stress test because you just went into the ER, but they might do an EKG. Well, we're not really seeing anything. We're going to send you home.
But what if you have heart pains in an airport or on a vacation or somewhere?
On the plane.
On the plane. You chew up Cataplex E2.
About a dozen of them.
Yeah, you chew a bunch of them. Some people, you can't take them in the place of nitroglycerin, but it does the same mechanism of action in a more balanced way.
Yes.
It
releases the stored up oxygen in the myocardium, the heart muscle.
That's what I was trying to come up with.
And it immediately provides the muscles of the heart with abundant oxygen, which is what nitroglycerin does.
Yeah. So
they're not sure how nitroglycerin does it. They just know it does.
Right. So Cataplex E2, and we actually have a podcast on this too, but keep those in your purse when you travel. If you have any heart pain or angina,
right,
or anything like that.
That the emergency room or a cardiologist hasn't already treated you for.
Now, if you have a chronic problem with heart pain or palpitations, we just got a testimonial for our long life energy enzymes that says, I have tried to fix my cardiovascular system. For years, I've had a situation where I feel my heart build up to a missed beat, and then a heartbeat followed by a slight tachycardia, with an overall sense of my heart beating almost all the time. Just 1 week of 6 a day of Lee enzymes, and my pulse has slowed to normal, where I no longer feel my heart beating and no more buildups to missing beats. I can't thank you enough.
That's great.
Isn't that great? And I've heard other people say that it's really helped.
Yeah, we created this thing for digestion, and we have people with all kinds of stuff talking to us about, not
off-label use.
Here's the heart. I mean, every
and dementia,
even dementia.
That's crazy. Man, you get that digestion fix, and who knows what's going to happen. All diseases begin in the gut. And another good thing for heart pain or palpitations is something called phosphate liquid. It thins the blood. And I shouldn't tell you this, but we had a truck driver that had too high of blood pressure. Should I not tell it? Should I tell it?
Yes, go ahead.
Okay, it's forbidden. And he took 4 or 5 dropperfuls of this phosphate liquid right before he had his Department
of Transportation test for his CDL.
Yeah. And it lowered his blood pressure to where he got his license. Oops. He's also on Lee enzymes, so
yes, he is.
Maybe he's better.
Combination of the two.
I don't know. But anyway, phosphate liquid in the short term will thin the blood, kind of like people use those stupid baby aspirins that they know causes strokes in the back of the head. Lots of studies on that. So phosphate liquid is a much safer way to thin your blood. But we are not telling you to go off any medication your doctor has given you.
Of course not.
No. And another good one is
soybean lecithin. Mm-hmm. It keeps cholesterol in suspension in the bloodstream. That's the one the cardiologist, when he had a meeting with his nurses, one of the nurses happens to be.
No, that was.
Oh, no, that's evening primrose.
Evening primrose.
Well, they work on a similar.
Well, that
cleans out the arteries.
Cleans out the arteries, so they're like silk inside. I didn't put that one in here, but that's good. You mentioned it.
Yeah.
So, soybean lecithin will keep cholesterol in suspension, which could possibly help you in a blockage of cholesterol.
Yep.
Yeah. And then last but not least, which we're scared to tell you about because it is illegal in the United States.
Not if it's prescribed by an MD.
Yeah.
And that's what Dr. Cowan prescribes in San Francisco. He's an MD.
Okay, maybe.
It's in his book. He says,
well, we're not prescribing it.
No.
But it's called Strophanthem. Quabane.
It's digoxin. It's digoxin, and it was used for heart problems for a long, long time. It's still being used for heart problems, but it comes from a plant, and it's a controlled substance, and it can only be prescribed. And Dr. Thomas Cowan in San Francisco does, and he has never ever had a second heart attack with people who had a first heart attack that he put on Strophanthem.
Just that.
Never had a second heart attack.
So
it's Strophanthem, STROPHANTHUM. You can Google Dr. Thomas Cowan, COWAN, in the San Francisco area, and talk to him yourself.
Yeah, there you go.
All right, the last one.
Depression, anxiety, or trauma.
Yes, now we had a recent podcast on depression, talking about a methodology that's been used for well over 100 years, or it was used 100 years ago.
They used to know this.
They knew that people who were having trouble with high stress, schizophrenia, suicidal thoughts, seriously aggressive behavior, bipolar, although it wasn't called bipolar back then, were deficient in magnesium in the brain tissue. Now, it's very difficult to get magnesium across the blood-brain barrier.
Yep.
So we put a podcast together on this, promoting something called EZ Mag, letter E hyphen letter Z.
MAG for magnesium.
And for MAG for magnesium.
It's a really crazy name.
And it's a very concentrated form of some dried green vegetables of wide leaf plants that are very high in a particular form of magnesium.
And they've proven they get through the blood-brain barrier.
Now, I think, was it Shelley or Shakespeare? I forget which one. A rose is a rose is a rose. But a magnesium is not magnesium is not magnesium. There are, how many? 22 different forms of magnesium in the brain.
They don't even know which one it is.
They don't know which one it is, but they know one of these gets across the blood-brain barrier, and when the brain is adequately supplemented with the right form of magnesium, flooded with this magnesium, their entire outlook changes for the better.
So you just take one stick. This is our only stick pack we have. Take one stick in about, 4 ounces of water. Cold water, by the way, makes a big difference.
Stir it up really good.
Shake it up really hard.
Shoot her down.
Just shoot her down. That really helps with depression. Another one that we've had great success with is an herb, and it's called Nevaton Forte.
Nevaton.
Nevaton Forte. It calms the nerves. It restores the balance in mood swings. It supports your nervous system, and it helps encourage balance between the body and mind. And it eases the effects of occasional stress. If I sound like I'm reading, I am, because that's what it says. But honestly, it is a wonderful herb. We have a really good podcast. A protocol for depression, and Nevaton is the basis of it. Now, to fix it foundationally, we recommend you doing GAPS, but this podcast is on quick fixes, and I can put that handout at the bottom. I forgot to add that, but I will add that at the bottom of our podcast for depression. But Nevaton is a fantastic herb. We also recommend something cheaper that is called two things, Orchex and Minchex. And these are just very calming. They have a whole bunch of stuff in them. That's why they're called Chex, because they have a calm...
CHEX.
Yeah. Oh, that's not a complex. It's a Chex. Anyway, I have to tell you a quick story. My daughter works in fashion in L.A., and everybody weighs 2.4 pounds.
Yes.
They're zero.
And they only eat cabbage soup.
They don't eat cabbage soup. They eat coffee. They drink coffee all day long, and they eat a few almonds. Anyway, they're all just endocrine nightmares. They're all just beyond moody and miserable and depressed and So my daughter started passing out Minchex, and they were like, "What's that drug you use? It works so well." Yeah. Of course, it's not a drug.
And it just has a bunch of micronutrients and trace minerals in it. Yeah, that calm the brain down.
Yeah, it also has orchic extract in it. Do you want to tell them what that is?
No.
It's ball juice. Okay, I told them. So anyway, it is a wonderful calming, both of them. Orchex. Orchex is more for explosive anger. And
especially in a male.
Especially in a male, because of, we won't mention it again. And then the Minchex is more for just general depression. So then the last one, this is the one for trauma. This one is called Thymus PMG.
Mm-hmm. It's the protector of the heart. It's a protomorphogen for the thymus that sits right on top of the heart.
Isn't that beautiful?
Mm-hmm.
It's a protector of the heart, and you need to take it on an empty stomach, and that's what I would take if you've had some severe emotional trauma, not physical necessarily.
And this way, it wasn't created for that problem.
No.
It was just discovered that people who were taking Thymus PMG for thymus problems, who had severe emotional trauma, seemed to do much better when they took the Thymus PMG.
Yeah.
So it took on a reputation over several decades of being the protector of the heart.
So, 4 things. Easy Mag first is really good for depression. Nevaton Forte in combination with our little protocol, if I can remember to put it on, Orchex or Minchex, and Thymus PMG.
Yeah.
Okay? Those are really good for depression, anxiety, or trauma.
So let's recap.
If you have any of these problems, anytime, you might want to have these products on hand all the time. I will put another handout at the end of this podcast called the Alternative Medicine Chest, and it will help you with many other acute problems. But we just wanted to have a quick podcast for some of these really big ones. So we, Mary and I, go by the moniker of the Forbidden Doctor, but we're not the Forbidden Doctor. Mm-mm. The Forbidden Doctor isn't some reclusive hideaway on the south side of town that's hidden in some backdoor garage room or some poor fool of a med school dropout who's secretly performing, hidden surgeries. No.
The Forbidden Doctor is that beautiful, marvelous, almost miraculous healing force that's inside of you and all of us. It's that innate intelligence, that life force directed influence that triggered your DNA to build your body after conception. It's that power that sustains your life. It repairs your wounds, your lesions, and the distressed and disrupted actions that are deep in the several systems of your body.
It's that essential part of you that keeps you alive and heals your every hurt.
Yeah, and it's that part of you that the powers that be have decreed forbidden to ever learn about or even consider, and never, ever rely upon your ability to heal yourself, because it's forbidden that you even know this life force exists at all.
All healing is self-healing.
Yes.
No one heals anyone else. No one cures anyone. The body cures itself of whatever it's suffering from. Somebody can remove the restrictions that prevent healing, like through surgery or whatever emergency intervention might be necessary, or someone can add something that's missing that might be retarding healing. But at the end of the day, the body heals itself. So anyone who takes credit for healing someone is lying to you. Yes, someone can save your life, but healing is another matter. The body heals itself.
Now, this is the Forbidden Doctor, the doctor that's inside you that you are prohibited from knowing anything about by the powers that be.
So don't forget to take our symptom survey that we offer at the homepage, our homepage, forbiddendoctor.com. That survey is the most comprehensive survey you will ever take. It has tons of questions. And after you're done, you have the opportunity to have a free 30-minute phone consultation if you want. You don't have to do that. But you will be given a personalized supplement protocol. And this saves you money in the long run because you're not taking supplements you don't need. And all of this at no charge to you.
Yeah, and if you do decide to purchase the recommended supplements, you can get them at a 10% discount if you sign up for our text blasts. These text blasts give you fantastic coupons every single week. Just text the word healthy to 41411, and we will text you back a coupon code, which you can use on our website, forbiddendoctor.com, when you check out. Or just call the office at 801-523-1890, and they can help you sign up for the text blast. And remember, everybody, it's your patronage of these offers that keeps this podcast on the air.
We have got to rip a hole in this universe, exposing one forbidden tidbit at a time.
Now, many of you may be finding us for the first time. Keep in mind, the protocols on our website and what we're talking about are only available to logged-in users. But you can create an account instantly by taking our free, no-obligation symptom survey.
Yeah, or you can, again, call our office, 801-523-1890. They can help you sign up for the text blast or the survey or answer any questions about the supplementation and even our Forbidden Doctor's mission. So, the statements made in this podcast and about specific products have not been evaluated by the United States Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent disease. All information provided or any information contained on or in any product, label, or packaging or this podcast is for informational purposes only and is not intended as a substitute for advice from your physician or other healthcare professionals.
So thank you for listening to this Forbidden Information in our Forbidden Podcast.
Join us next time for another in-depth discussion of forbidden knowledge.
Yeah, we'll see you then.
We'll see you then.
Thank you for listening to the Forbidden Doctor Podcast. If you are curious about long-life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com or get our enzyme formula from Amazon.com by searching the full term, Long Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.